The good news is between this and the finasteride we already put in the water, nobody's having premature ejaculation. So that's a bonus. What about SSRIs? Should those also be over the counter? That was the other thing that I believe I suggested we should put in the water.
Yeah,
You can actually already put this in the
you
water,
can test. Correct me if I'm wrong. You can test your water for these now, right?
I did test my water for SSRIs.
Any SSRIs in your water?
Do you think that there was?
No.
No SSRIs, no ethinyl estradiol. I actually didn't have any of the medications that were on my TAP score test in my semi-city, semi-country water. Switches back and forth between the two.
All right, so this is, I guess if you're looking at the spectrum of things through a risk-reward lens, this is higher risk and potentially higher reward. If you're looking at how many people are depressed, how many people are potentially suicidal, how many suicides would you prevent? And then on the flip side, you're thinking, how many manic events am I going to cause if these are going over the counter? How many increases in suicidal ideation am I going to cause if these go over the counter? That's one of the things that you warn someone about if they start an antidepressant, is that they may have, sort of new suicidal thoughts. And I think that's more of a concern in younger individuals, adolescents, but not something that could be completely unheard of in adults.
Yeah. The good news is between this and the finasteride we already put in the water, nobody's having premature ejaculation. So that's a bonus.
Yeah, no, but I think you'd have to do the same thing. You'd have to do a pilot study of some sort where you're looking at a high-risk community, but there's a lot of suicide, unfortunately.
Military bases.
Yeah, release these SSRIs, and then you sort of wait a couple years and then crunch the numbers and see, okay, what are these outcomes telling us? How much harm are we causing and how much good are we doing?
Mm-hmm. Yeah, but I think we did stop doing population-based study without people's approval after things like MK Ultra and whatnot. So probably no study like that's going to happen.
This
in the
isn't
future.
MK Ultra. I'm talking about MK Light.
Just light, just
not ultra.
Psychiatrically active medications. Yeah, that is indeed the study design that would be necessary, but it is probably never going to happen. Hopefully never going to happen.
Yeah, so they probably would do more of a technology-based solution similar to the statin where, they use probably not fluoxetine because of the drug interactions, but another SSRI.
Trintellix.
Hopefully it's, I was going to say vortioxetine. Hopefully they choose that one. And then, people fill out the questionnaire for depression, get their, SSRI delivered. But again, a lot of the people with, depression are probably not going to be the first adopters of a health technology.
I wouldn't be completely opposed to over-the-counter vortioxetine.
Yeah, so it's basically like you take a direct-to-consumer SSRI company now, and you just remove the clinician, which improves or reduces the cost to the consumer.
And I don't really necessarily think removing the clinician is important. I think removing the greedy ownership. And ideally, the pharmacy benefits manager and the insurance company and the coding and the unnecessary documentation. I think that is the main reason why it would be beneficial.
Yeah. Well, an app or a health technology like this will not remove a greedy owner, probably. Somebody has to develop the technology.
It would be more like
unless it was a government subsidized one.
It at least won't be an owner of a service that connects patients with the clinic.
Yeah, and it would remove clinicians. I suppose they would just direct people to, suicide hotlines and so forth, provide people with resources along with their medication.
Mm-hmm.
They'd probably try to figure out the least bad way to do it.
Yeah, put in a little bit of memantine or ketamine, or dextromethorphan.
Yeah, that was my joke when I saw this. I said, well, why do we need SSRIs over the counter? Isn't dextromethorphan already over the counter? And of course, that is a joke, but dextromethorphan is part of a combination drug now for depression. The other ingredient of which being bupropion.
I knew some people who were ahead of their time.
Yeah.
That's why they were doing that.
When I was in college, not me, but I remember reading about what they call it, robo-tripping or something like that, where people were overdoing it on the dextromethorphan and probably not great for your brain to be doing that.
Is overdoing it on ketamine great for your brain?
I guess overdoing
Same
it is
receptor.
relative. How many mgs per kg are we talking?
Less than 1 mg per kg.
No, that doesn't seem excessive then.
All right, that is not medical advice for those of you out there who are curious. But yeah, in all seriousness, dextromethorphan, I think, was relatively recently approved in combination with bupropion for mood symptoms for treatment of depression. And of course, the generic is over the counter. It's not that it's active at more receptors than NMDA, though. I believe it's also an alpha 2 antagonist. So it's not a perfectly clean scalpel mechanism of action.